Hi, my name is Subir Batra. I am the CEO of Curate Wound Care, and we are sitting here today on this wonderful first day of the Indian Podiatric Association Andhra Pradesh Telangana Chapter Conference, the IPA Con 2024, and I have with me Dr. APS Suri, who is I would say the pioneering voice in the field of podiatrics. It would not be wrong for me to say he's the most prominent voice in podiatry, and he's the founding president of the Indian Podiatric Association. Sir, I will not go too much into the detail. I think why don't you speak about yourself a little bit and how you came up with this whole concept of the Indian Podiatric Association, which is to me a very, very needed concept. But I would like you to explain this a little bit to the audience.
Thank you so much, and nice to interact with you for today on the first day of IPA Con 2024 here in city of Hyderabad. Way back in 2001, 2002, I was studying in US. I did my podiatry residency from Boston, from Bethesda Deaconess Hospital. After completing my MBBS, I went to USA to internal medicine, and from there I got the concept of podiatry. And when I was discussing with my forefathers in the medical college, they told me that if you have to go back to India, then you get into this podiatry, otherwise you continue into internal medicine. So I was doing my internal medicine there. So there I shifted myself to podiatry, because podiatry is a branch which is far more developed in US and in the European countries, and it was not very prevalent in India. After completing my education there, when I came back to India, I found it about hard time in next 4 or 5 years. We wanted to bring people together. It's not that people were not working in foot care or diabetic foot ulcers. Most of the orthopedic surgeons, general surgeons, vascular surgery was not that developed that time. Physicians and diabetologists are very vague in their knowledge on podiatry. They have good concept on diabetology, but foot care was very incipient stage for them. So it took us hard time for the core group to develop. We have 10 to 15 core group members of IPA, and to get the name Indian, we have to have members from 10 states of the country.
Okay.
And it took me about more than 5 years to get like-minded people or to get the
That
society
is some persistence.
registration. Yes. And
Persistence जो आपने किया,
Yes.
I mean that is mind-boggling.
Yeah.
And you know, the slogan of IPA, I prevent amputations. I think not too many people know this, and it's a great thing that came from this group. But not too many people know this, that in the world, and it's a staggering number, every 2 to 3 minutes there's an amputation.
yes.
And a large numbers of these amputations are preventable.
Yeah. When we launched podiatry IPA in 2009, we made this slogan, I prevent amputation. That's coordinated with Indian Podiatry Association, IPA.
Right.
And then we started doing the state chapters, and slowly, first the Delhi state was launched, then Haryana state, Punjab state, and now we are proud to say from 2009 to 2023, we have 17 state chapters in IPA. And more than 4,000 doctors are connected with this slogan of I prevent amputation.
Absolutely.
After doing a lot of conferences and workshops, we designated this slogan since it was launched, that the main goal of our association, the society we registered, was to give education to the doctors who are already in the practice, what were the basic technology, new products, new inventions, or how they can very meticulously deal with their patients who come to them with the diabetic foot ulcers. A patient who has a diabetic foot ulcers, very quickly, as you rightly said, 1 out of 3 or 1 out of 4 will land up in an amputation. Imagine a patient who goes for a below knee amputation or an above knee amputation. The mortality rate, now international data and Indian data shows that mortality rate is only 5 years for that patient, because they can't exercise, they can't walk.
Which means within 5 years
He will die.
he will die.
Because of the myocardial infarction, because already when a patient has got amputation, he already had coronary artery disease also. So because of the lifestyle, they usually die. So that's why
even people who don't die,
prevention of amputation is the main goal.
right?
And with that goal, we move forward, and now we are having.
I think what you also done through this association, to a large extent, you created this in a sense, you are creating a specialized field of wound care, a specialized field which really was neglected so far. I mean, today, if I have a problem, a DFU problem, if I have a podiatry problem, I really don't know too many places to go to. And the patient would typically go to his, general practitioner, his normal surgeon. But you've helped create this industry by itself, which is a specialization on wound care. And I see that with Dr. Murthy's Advanced Wound Healing Center also coming up. So more and more centers like this come up, and I think that will create a lot of awareness.
Absolutely. Our members are running wound care centers, one in Chandigarh, one in Amritsar. We have a very renowned center in Hisar in Haryana.
Okay.
We have about 11 to 12 centers in Maharashtra, in Nagpur, Pune.
Wow.
We have our members very well doing in Mumbai. We have Dr. Palvi, Dr. Tushar Rege, Dr. Rajiv Kovil, Dr. Gautam Goyal in Mumbai. Then tomorrow early morning I'm going to Lucknow. There's a big meeting coming up. It's today and tomorrow again in Lucknow, which is clashing with this Hyderabad meeting. But that we are doing a very big meeting workshop, 2.5 hours diabetic foot care workshop by IPA in Lucknow. Dr. Ajoy Tiwari is working here. In month of December, we were in Calcutta. We had a big meeting where more than 250 doctors attended. I was just expecting 50, 60, 70 people, and we crossed more than 250 doctors in Calcutta with the launch of the Calcutta chapter. So now in March, we are having again a big meeting over there, where we are having doctors from Assam, Nagaland, and that part of the country also, eastern states. We are doing a whole meeting in Calcutta. We have a chapter in Chhattisgarh where Dr. Sunil Kalda in Raipur, he is running a very big wound care center. He is a plastic surgeon. Then we have one center in Aurangabad, Dr. Ramakant Bemde, he is again a plastic surgeon running a complete wound care center. We are just coming up with the launch of the Kerala chapter in April this year, where a lot of doctors, physicians, because Kerala has very high prevalence of diabetes.
Yes.
And mind you, what I've seen in the whole country, that all physicians, even MBBS doctor in Kerala, he practices diabetic foot care. Because so many people suffer with this, either it is bare walking or whether it is genetically we are more prone in the southern part because we are Dravidian population. So we are high risk population for developing diabetes. And so
Even
is the foot ulcer.
as it is, about 12% of the Indian adult population is suffering from diabetes, and that is going to increase. So we are talking of 10 crore, 12 crores diabetic patients, and about 20% of these typically end up having DFU problems.
24%.
24%.
Even type 1 diabetes. Recently, there's a study with in 2018 to 2021. 3 years the study was there just after COVID, which was during the COVID also they stopped it, but just after COVID they came up with this data where 60,000 children from class 7 to class 12, they were examined in Delhi and neighboring states, and they find out that the BMI of the children. So 42% of the children out of 100, 42 children out of 100 had higher BMI according to their height and height. 42%. That shows that these are the children who are going to have developed type 1 diabetes or type 2 diabetes later on. And these are the children who are tentative to develop diabetes, hypertension or arthritis or other diseases because of the obesity. That's why our diabetic population is increasing in our country. Type 2 population to high hai. Type 1 is also adding, our young generation is getting into diabetics. So
that is why the need of this association, podiatry, and the efforts that you're putting in is extremely. In fact, sir, we actually got inspired from you, and you are really an inspiration for a lot of doctors, a lot of people who are coming into this field. So, in fact, we as a company also had this. When we're talking to you and we've interacted with people in your association, we got inspired to create a Curate Academic Foundation, basically with the aim of threefold aims, basically to impart training in association with universities and colleges. Secondly, to create awareness. The kind of awareness that you're creating, we said, okay, from the industry end also, let's create something that creates awareness, and to do research into coming up with new products, fundamental research to see what can the products that can be used for treatment of these.
Absolutely, that is nice. That is the need of the hour. because we and Indian Podiatry Association, we are running courses. We are running to 2018. We are running a fellowship in diabetic foot management. It's an online course which contains 42 chapters.
Okay.
And now we are associated with Northampton University.
Wonderful.
So our doctors, after completing this, they can either come to Delhi or at my center and have 1 week of observership, or they can go to Northampton University also. Last year, in 2021, we coordinated with California University in USA. With that also we are coordinating now. It didn't started, but we are at the end of the verge on completion with that. So one of the international universities we are doing, and already 168 doctors have completed this course, the fellowship in diabetic foot management. Even MBBS level doctors are eligible to do this course, and they can start practicing into diabetic foot care with the developing of this course. So we are already doing this type of analysis. So we will love to associate with you and take this at a higher step, so that more and more doctors we can, because you being a pharmaceutical company or app company, you can have the field force going in all the part of the country, and you can spread this to MBBS level doctors, general physicians, general practitioners, even general surgeons. The main aim is to catch general surgeons who are just coming out of their practice, getting into the market with 4-5 years of experience. They are the one who will be interested to develop diabetic foot care or wound care practice, just like Dr. Santosh. He was actually my student. Now see how...
I'm sure that is just one of your students. You have so many students out there.
Too many.
It's true. You mentioned the app. I mean, we just launched the app, and you inaugurated the app for us, which is a great thing for us. The app really is about creating a standardized assessment protocol, about ensuring that data is stored, ensuring that wound progress is monitored over a period of time using objective parameters, and most importantly, like you said, you have young surgeons coming in, they are getting trained by you, but they will still need some kind of on-the-job training, so to say, right, with live patients. So this app allows them to collaborate with you. So if they have a patient coming in and they want your opinion, they can actually share the data with you, and you can, or anyone of your, the senior, more experienced doctors can help them with the treatment and give suggestions. So that is something. What do you think? Of this concept?
App is developing an app, and a wound care app is a very good thing. I welcome you all and congratulate you for developing this. It should come in the market as soon as possible. We from IPA can spread to all of our members. We can think of modalities, how we can spread it, how we can give it to that. The main aim is you can have a very good data collection with that, because we have more than 4,000 doctors connected with us. Even a doctor in the periphery, when he is seeing a wound care, he can immediately click a picture, he can take the size of that. We can evaluate how much is the biofilm over there, how much is the exudate. Subsequently, in next 2-3 weeks, whatever he is doing, debridement, he is giving antibiotics, he is taking care of the bone infection, he is taking care of offloading. Then wound bed preparation, how is the wound bed preparation, whether the surface area is reducing or not. Now we have a trial, and we know the guidelines that in first 4 weeks, if your wound area is not reduced less than 50%, I'll say again, in first 4 weeks of any wound care practice, if your wound is not healing less than 50%, like the surface area is 2 inches, in next wound it is about 1.5 inches or 2 inches only. That means your wound will not heal in next 12 weeks. So now you have to reassess your practice. You have to see whether there's infection in the bone, whether offloading is not proper, you are not giving antibiotics properly, or sugars are not contained. So any problem it's having in the bone. So that this information can be known to the doctor with the help of the app. That my wound surface area is not reducing, my biofilm is not reducing. Every time I open the wound, the charge is there, the wound is not healing. That can give the information through the app. Also, data collection is very important. Type of neuropathic ulcers, neuroischemic ulcers, venous ulcers, pressure ulcers. That information is very important.
And we are what we want to do is create case studies out of that, which can help for the research purposes later on, get it published. There's very little data that comes from India for most of these cases. Second big application I see is from a training perspective. You have students, right? You have people coming, doctors coming, getting trained under you. After they go back, you can have some assistance that you can give them.
Yes, always do. At this moment, we are doing by different WhatsApp groups.
Yeah.
They put the photograph of the WhatsApp group, they immediately send to me or to my staff. Immediately we go back. Me and Dr. Ravi from USA, we collaborate. He's a vice president of IPA. You just have seen the lecture over there. So we collaborate very quickly and give them the answer to the doctor. This antibiotic, this dressing, alginate dressing, collagen dressing, foam dressing, whatever he needs to use, whether you need to use any hydrogels have to be used, debridement has to be done, offloading, what type of offloading has to be done, then VAC therapy, PRP, advanced technology, dermal matrices, everything we give them an idea into this. So yes, it's a comprehensive wound management, sugar control, metabolic control, that's also very important.
It is not just one part.
No.
I mean,
It's a
it is
comprehensive
comprehensive.
wound
It has to be comprehensive. You have to take care of nutrition. You have to take care of comorbidities. You have to take care of the base condition, infection. I mean, there's so much. And that is why this is so. It's a complicated field.
Any wound will not heal if you don't have proper proteins or albumin, globulins in the body. We have to see that nutritional status of
Sir, आपके साथ ना एक हमारा भी training session करना पड़ेगा. We will what we would want to do, and we have these doctors, not just here but outside also. So Uganda में हमारा जो अभी Devashish has gone there for a lot of sessions. They are looking up to Indian doctors. They're looking up to experts.
I've been to Nairobi twice. Last year I was in Nairobi in August. I had a meeting. I think more than 160, 150 doctors would have attended. Doctors from Zambia,
and they come
Tanzania.
from across
They come
different
to Nairobi,
countries.
And it was by the Lions Club. No pharmaceutical was involved in this. It was a Lions Club initiative in diabetes. So they put my session, and my session was for about 2 hours, but it went more than 4 hours. So many questions were there, and basic questions by all the doctors. And most of these are Indian doctors, you see.
Achha,
Yes,
Indian doctors settled there.
Doctors, they are settled there for generations together. Because long time when teachers were there, it was all Indians who went over there for that long train and diamonds and other things, gold you see. So those are the Indians who have settled down there. They are citizens there, and many of them are doctors now, and they want to learn this podiatry or wound management. So that's a very big country.
I think even there it is. I mean, country or not, I think it's a great cause. India में ही इतने लोग हैं जिनको जरूरत है.
I have 18 IPA members, life members in Bangladesh.
अच्छा, in Bangladesh.
6 orthopedic surgeons and 5-6 MBBS level doctors, and they are doing wound care and podiatry.
अच्छा, यहाँ पर IPA Con में ना बांग्लादेश एक ब्रिगेडियर आने वाले थे. अच्छा, आर्मी हॉस्पिटल के वहाँ से. He unfortunately he could not come, but he was very interested in coming. He was saying आप हमारे लिए यहाँ पर कुछ arrange करो, हमारे doctors के लिए यहाँ पर. So there's a lot of interest there, and we would love to have you go there sometime.
Yes, we can do a collaborative meeting there and give lectures for the doctors there. You can arrange that. We can surely
Absolutely,
go.
sir. Absolutely, sir.
Good.
Thank you so much for this time. एक और last चीज़, I mean, people look up to you. नए doctors, students, उनके लिए आपको कोई advice, कोई suggestions to see how they can grow up in this field or any other field?
Try best to save amputation for the patients. That is very, and there is no patient whose amputation cannot be prevented. Any level of infection, any level of wound care, the bad wound is, we can increase the blood circulation, we can do with the help of the vascular surgeon, we can take help of the diabetologist, we can take help of the orthopedic surgeon, and it has to be a comprehensive wound management, and that's how, and there is no wound or no patient where amputation cannot be prevented.
If done on time.
If done on time and with proper technique and technology. That's
Sir, एक बार हो जाए अपना logo?
Yes. मैं आप खड़े होइए. Raise your leg.
Okay.
I prevent
amputation.
This is the logo. I prevent amputation.
Thank you, sir. Thank you so much. Thank you.